I'm Dr. Dean Sidelinger, the health officer and state epidemiologist here in Oregon.
Okay, perfect. If you could just quickly give me a rundown on the decision that OHA just announced and what it means for Oregonians.
Today, we're filing the rule to continue mask requirements in indoor public settings as well as K-12 settings here in Oregon. These are tools that will help us combat COVID-19 as we get through this current Omicron surge. We're also announcing that based on data trends that we're seeing and the forecasts that we see in data, that hospitalizations should go down to a level where they were pre-Omicron of about 400 by the end of March. And so we anticipate lifting the general public and school mask requirements on March 31st or sooner if those data trends accelerate. This will give our local partners as well as our schools a chance to prepare for either implementing a local requirement for masks in schools or other settings, or to prepare for procedures that will be in place when those mask rules are lifted. So we're announcing the extension of masks as well as what the endpoint is for masks together so that people can make decisions. And we can continue to implement the protective measures that Oregonians have been so good at during this pandemic, wearing masks, getting vaccinated, limiting their gathering sizes, particularly during surges that have kept Oregon successful at fighting this virus and keeping our case rates and death rates low.
And I also read that it looks like employers and businesses will have a little bit of a different situation, even while the state may be lifting these mask mandates by March 31st moving forward, businesses might not.
So what we have mask requirements will be in place in under three different rules for the general public in indoor public settings, in K-12 settings, as well as in healthcare settings. By March 31st, the rules for indoor public settings as well as K-12 settings will be lifted, but masks will still be required in healthcare settings by individuals, staff, contractors, volunteers, as well as visitors, patients, and other customers in those settings. These are settings that serve all Oregonians, often some of the most vulnerable, most at risk for complications from COVID, and it's where people seek care for COVID. So having masks continue in those settings is important. For individual businesses and locations after March 31st, if they would like to continue requiring masks for their employees, their staff, for customers and clients they serve, they can do that. We also hope that businesses will support individuals' choice to continue to wear masks in those settings, whether it's their staff or the customers they serve. Some individuals who are not vaccinated, who are at higher risk for complications from COVID, or who are immunocompromised, or return home to someone in one of those categories may want to continue wearing a mask even after March 31st. So we hope businesses will support that and support individuals in their choice to continue that.
So I know also in Oregon, we've got a bunch of people who are just fine masking, wherever they go, but then there are also those people, another group who are very much so against masking. I know there's been public comment on this issue. So I guess, why issue this permanent indoor mask rule when, we've heard a number of people testify and just speak out against it?
I want to say I appreciate all the Oregonians who provided testimony over the last couple of weeks and provided comment to us about the impact of wearing masks on their lives. We heard several stories of people with health conditions and others that have a difficult time wearing masks. At the same time, I want to thank the vast majority of Oregonians who continue to wear a mask to protect themselves, their loved ones, and those around them. When we wear masks in indoor public settings, it protects not just ourselves, but those around us. And Oregonians have overwhelmingly continued to wear masks and take other steps, such as getting vaccinated and being up to date with their vaccinations, staying home when they're sick, and changing their activities during times of high COVID spread. Surveys show that over 80% of Oregonians report regularly wearing a mask. So by announcing this rule now, it'll give the vast majority of Oregonians a chance to plan for whether they will continue wearing masks after March 31st to protect themselves, loved ones who are more vulnerable, a chance for those institutions and businesses to plan because we've taken all that into account. But right now, there are over 1,000 Oregonians in the hospital with COVID. That's a number that continues to strain our healthcare system. And so having these requirements in place for the next several weeks is important as we get case rates back down return to a level where hospitals are better able to care for patients without the strain that they're experiencing now, and make sure that that quality care we all deserve, whether we have COVID, a heart attack, or have been involved in a car crash, have the ability to access the quality care we need. So these mask requirements are in place for now, but in several weeks, providing the trends continue, we'll be in a place where individuals will be making their own decisions about masks in these public settings.
And say, March 31st comes around, masking requirements, in indoor public spaces and all that, they're lifted. How likely is it that the state would then revert back to a masking requirement? What would conditions have to be?
I think it would be unlikely that we'll see, reimposition of mask requirements broadly across Oregon. The Oregon Health Authority, our local public health partners, continue to monitor disease spread in the community, continue to see the development of new variants and whether they are more contagious, cause more severe disease, or that our vaccines aren't as effective. On the other side, we know that our vaccines remain effective, even against variants that weren't around when they were tested and released. And we know that the oral antivirals that were developed are very effective at preventing severe disease in those who get sick. They're in short supply now, but as manufacturing increases, we'll see more of those in the community. So we need to look at potential negative impacts of new variants, but we also have great preventive measures with our vaccines and medicines that can help prevent severe disease. So looking at all those things together, using all the tools in our toolbox, I don't know that we'll see the widespread mask requirement come back into place. But at times, if cases increase in the future, likely individuals who are at higher risk for complications because of underlying conditions, or they're immunocompromised, or they live with someone in those categories, may choose to wear masks and limit their time in indoor public settings during those times to protect themselves, the loved ones they return home to. And that will help keep people safe, keep people out of the hospital, and hopefully limit the impact of severe disease in the future, no matter what variant or other clinical piece that COVID-19 throws at us.
Yeah, and you had kind of mentioned potentially new variants down the road, and we often don't know what's headed for us. Who knows, we could have another Omicron or Delta or something worse. But it is interesting to note that the state isn't thinking about reinstituting the masking rules. And what kinds of, I don't know if you can just give me a sense of the kinds of conversations that health experts, yourself at the state level, are having when it comes to balancing public safety, especially because there are still so many Oregonians who are not vaccinated or boosted, with just moving on with life as if it were somewhat normal, sort of pre-pandemic. How do you balance these two things when you've still got a number of people, many people, who are still unvaccinated and not boosted?
Yeah, I think throughout this pandemic, it's always been a balancing act. So there are the direct physical impacts from COVID. People who are ill, and even with mild or moderate illness, that doesn't mean that they're without symptoms, or it doesn't mean that they're not missing work or school for a period of time while they're sick, to preventing more severe disease, hospitalizations, and deaths. But we know that the anxiety, the limits on visitation in nursing homes early on in the pandemic, the move to remote learning in schools have had other impacts on our social and emotional health, our behavioral health, and have had other wide-ranging impacts, including economic impacts that have been partially offset by some of our federal programs that have helped individuals with unemployment and helped small and medium and large businesses get through this. But there's multiple impacts from COVID-19 that we need to balance. Right now, at this stage in the pandemic, we're at a different stage than we were throughout 2021 and throughout 2020. We have widely available, safe, and effective vaccines. And while we still have a large number of Oregonians who are not vaccinated, we continue to provide those vaccines in multiple communities in different settings so that we can try and get their questions answered and get them vaccines as they need them. We'll have vaccines available shortly, hopefully, for the youngest children, 6 months to under 5 years, that will help ensure that that portion of the population who's not yet eligible for vaccines can get them. We know that our oral therapeutics, our antiviral medications, will be in greater supply so that if individuals do get sick, those who are most at risk for complications can take this medication to prevent disease. This is a much easier formulation than some of the medicines we have that currently require an IV or an injection and need to be delivered in the healthcare setting are monoclonal antibodies. So we have these additional tools at our disposal. We know that case rates are going down fairly significantly in Oregon due to the Omicron surge. Our hospitalizations are fairly flat, but we anticipate those will be coming down. So the disease burden in the community will be much less by March 31st. But that's why we're not announcing that the mask requirements are going away today. We know disease is still fairly prevalent throughout most of Oregon. Over 1,000 Oregonians are in the hospital today with COVID, but the trends look good. And by March 31st, we should be in a place where individuals will make these decisions to protect themselves, their loved ones, and those around them. And we can move into the spring where COVID isn't the dominant factor impacting our daily lives, where we're worried about our kids being in remote learning because teachers are out sick and the school can't offer in-person instruction. We'll be at a place where our healthcare system is not as strained as it is now, and where the businesses in our neighborhood aren't forced to shut down because they have staff shortages because staff are out with COVID. By the end of March, if those forecasts hold true, the data trends we're seeing hold true, we should be in a much better place where we're getting closer to where we live with COVID-19 and it doesn't have the significant impacts on our daily lives that it continues to have. I, like all Oregonians, are really looking forward to that day, and I think it is within sight. And announcing this lifting of the mask requirements is indicating that we're one step closer to getting there.
And I know you don't have much more time, but really quickly, I know that you're announcing the lifting of masking requirements on March 31st. Moving forward, do you still recommend that the people continue to wear masks while this requirement is lifted? Is it still recommended that people wear masks?
I think going forward after March 31st, we need to look at what conditions are like on the ground. We know that universal masking in school settings serves as a key tool to helping prevent transmission of COVID in those schools. And likely that is something from a public health perspective that will still be useful at that time in protecting all students and staff who are in those settings, those with disabilities and chronic conditions and others that may be more vulnerable. For individuals in the community, when they're out in indoor public settings, if you're unvaccinated, if you have a chronic condition that puts you more at risk for complications from COVID, or you're immunocompromised, or you live with someone who fits into one of those categories, you may want to continue to take extra precautions and wear masks in those settings, particularly if it's a prolonged exposure, a crowded setting. Wearing a mask can help protect you and the loved ones you return home to. So I certainly think that many individuals would still be wearing a mask because they fall into one of those categories.
Is there anything else that you'd like to add that we haven't discussed that you think is important to talk about?
I think, I would like to thank all Oregonians for continuing to wear masks, for being up to date with their vaccines, and for taking precautions to help prevent the spread of COVID-19. As a state, we've demonstrated that we've come together and taken actions that, while not always easy, have really helped to blunt some of the tremendous impacts of COVID-19. Our hospital surge right now seems to be peaking below what it was with Delta, and that's really thanks to the collective actions that all Oregonians have taken. I know they're not without sacrifices, but those actions have saved thousands of lives throughout the state.